Welcome back to 12 to Your Health. I'm Dr. Derek De Silva. This week's topic is one many find embarrassing to talk about because of the part of the body that's affected. We're talking about hemorrhoids, one of the most common ailments out there. In fact, as many as half of all adults have dealt with this by the time they hit age 50. Joining us to talk about this important subject is Dr. Robert Schumann, a gastroenterologist at St. Barnabas Medical Center in Livingston. Also with us is Dr. John Morello, a longtime hemorrhoid sufferer and the inventor of a device called the HemAway seat, which is designed to manage the condition. Gentlemen, thank you very much for joining us.
Thank you.
Dr. Schumann, let's start with you about what is a hemorrhoid?
All right, Dr. Silva, a hemorrhoid is a swollen or inflamed blood vessel in the internal part of the colon, the anal rectal area. And at times they get inflamed so much that they cause pain, burning, itching. But that's what it is, a swollen vein or blood vessel.
I mean, I use the analogy in my own practice of it's a varicose vein in your butt. All right? I mean, is that an oversimplification?
I think it's the proverbial pain in the butt, but that's exactly what it is.
That's exactly what it is. What about, Dr. Morello, let me just ask you the question. I mean, this obviously is a little personal, but when did this happen to you? What happened? What symptoms did you have?
Unfortunately, the saying, necessity is the mother of invention, holds extremely true in this case. I became a hemorrhoid sufferer, probably due to genetics in my case. My mother and my father both have suffered from hemorrhoids their entire life. So basically I keep a good diet, and I basically experienced the symptoms and experienced external hemorrhoids and sought the traditional route that many people to try to cure or help these hemorrhoids, and it really wasn't effective in my case whatsoever.
Well, let's go over to that then, Dr. Schumann, and say, what are some of the symptoms of hemorrhoids?
There are many. The most common are painless bleeding, which can occur during or in between bowel movements. You could have itching, which is a big complaint of many of our patients. Certainly when they become rather inflamed, it's very painful and uncomfortable. And swelling, or some people feel lumps in that anal rectal area.
And again, Dr. Morello, if you don't mind, did you have all of these, some of these? What happened with you?
I've had all those symptoms, and unfortunately, it's a very serious condition. It's life-changing. When these hemorrhoids present themselves, you could be in constant pain. It could affect your daily lifestyle. Sitting can be arduous. Daily activities can be arduous. And while these hemorrhoids are presenting themselves, it definitely is a very painful, life-altering condition.
Yeah. What about diagnosis? How do we make the diagnosis when this thing happens? What do we need to do?
Well, when a patient presents with certain symptoms highly suggestive of hemorrhoids, there's a few ways to do that. First, we examine the patient. We look at the bottom. We use what's called the digital rectal exam with our fingers if we don't see an external hemorrhoid. There are certain small procedures we do in the office called anoscopies, when you could look in with a very small device. And then, depending on the age of the patient and their symptoms, if it's unclear, there are procedures such as colonoscopies, which we utilize not to determine just if there's hemorrhoids, but we use a screen for other problems in the colon.
I think the bottom line here is that any time you see blood in the rectal area, you really need to get followed up by your primary care or a gastroenterologist.
Absolutely. You don't want to let rectal bleeding go unnoticed.
Right, because it not always could be hemorrhoids, could, God forbid, something else. What about causes? What are the causes of hemorrhoids?
Well, hemorrhoids affect so many people, and there's many causes. First and foremost is when people are constipated and straining. If they strain, that increases pressure in those veins. Sometimes you have diarrhea if you're going too much and wiping a lot. Sitting for long periods of time can cause bleeding. We see that in truckers, we see it in bikers. They're called saddle sores in bikers. If you're obese, just being overweight can cause it. And probably the most common thing is pregnancy. Both during the pregnancy and after delivery, we see hemorrhoids very commonly present.
And did you have all of these things bothered you too, Dr. Morello?
Yes, that's correct. And I tried the conventional.
Yeah, except pregnancy.
Right. Except
pregnancy.
Okay. That's correct.
We just want to make sure.
Yes, I did, and it's an embarrassing condition. And even being a doctor, when they presented themselves for the first time, it was almost a mystery to myself until I realized I did have hemorrhoids. Tried the ointments, the salves, went on the internet, tried the conservative, non-invasive treatments. maybe a little relief, a little relief from itching, until I had to go see a physician for a more invasive procedure.
Obviously figure out what was going on. What about
Correct.
treatments, Dr. Schumann? What do you do? How do you manage these people?
Well, I think there's a few things. People who've had them, we want to prevent them. So we advise a high fiber diet. You should get between 20 and 25 grams of fiber a day. We want to drink a lot of fluid, especially it's hot outside. 6 to 8 glasses a day of a beverage, water preferably, not including wine and alcohol
Right.
in general. Supplements help. Probiotics have been very helpful. We find that very helpful. And then once they're more active, there's conservative methods of treatment. We utilize over-the-counter preparations, topical creams, suppositories, and whatnot. And then, there are more aggressive treatments once they're very active.
Right. Dr. Morello, you were instrumental in the development of this, which is very interesting. And we have a graphic on this that we'd like to show some people. Tell us a little bit about this and what this is.
Sure, that's the HemAway seat, which I invented. It's a FDA-cleared product. We have patents overseas, patent pending in the United States at this point. And actually what it is, it's so simple that people almost are amazed how it works.
So what's going on here?
The individual will sit on the seat when he has external hemorrhoids presenting themselves. By merely sitting on the seat, your own body weight with the designed shape of the HemAway seat will allow almost a vacuum effect in the anorectal area, and the hemorrhoid will actually retract back inside the body. It's hands-free, it's painless, and once the hemorrhoid is back in your body, and I'm sure you doctors can attest to that fact, the healing process starts, and bleeding and pain immediately subsides.
Now, this is not a seat to sit and have a bowel movement on. This is a seat to sit on once you have the hemorrhoid, once you've had your bowel movement, etc.
That's correct, doctor, and it's funny you mention that because people say, how do I go to the bathroom on that? And that's not what it's for. It's for after the hemorrhoids come out to sit on the seat, and it just conveniently sits over the toilet seat because that's a very convenient place to treat this condition.
Right. I mean, you've seen this work?
Absolutely.
Yeah.
It's people who've tried other things, more aggressive treatments, and they come back often. This is a painless, easy to utilize technique, and it works.
Thank you, gentlemen, for joining us. Congratulations with the great work.
Thank you very much for having us.
And folks, once again, if you have any questions or comments about today's interview, or if there's a topic you'd like to see discussed on our program, email your thoughts to us at 12toyourhealth@news12.com.